biggest message I want to tell the community of Hendricks County is we need to prepare, we need to be safe, but we don't need to panic. We really, really don't need to panic.
Right now at 5 o'clock, breaking news. State health officials now confirming 4 total cases of the coronavirus here in Indiana, including 1 child in Hendricks County. Now Avon Community School Corporation canceling classes for 2 weeks. School officials now say they're monitoring a second student who is showing symptoms of the virus.
Tonight we bring you team coverage. We'll talk with David Williams and Dr. Mary Gillis here in studio. But first, let's get to Aaliyah Hodges.
Well, officials say a second student has been showing symptoms of the coronavirus since Sunday. Now, right now, that student is being quarantined at home. Health officials are tracing everyone that student has been in contact with, as well as the student has been confirmed of the coronavirus. Now, that student is Well, that student is also being at home, but the school district is now being shut down for the next 2 weeks, followed by 2 weeks of spring break. Now, I spoke with some concerned parents. They say that Avon Schools usually does not shut down, so now they are very worried. The decision is forcing parents to make alternative plans for their children, such as daycare. That can be a very inconvenience for some of those parents that I have spoken with today. Now, school officials did address during a press conference that they will be providing to-go breakfasts and lunches for those students. Parents are able to pick those up starting tomorrow. And health officials are asking parents to take this time off very seriously. They are asking families, while they go on spring break, to stay away from other social events, to stay at home and to take this time very seriously. Now, parents are able to pick up these meals at Cedar Elementary and Avon Middle School at their parking lot starting tomorrow at 10 a.m. to noon. And also, parents can pick up meals here at Avon Administrative Center during the week as well. Now, stay with us on air and online for more on this developing story. For now, reporting in Avon, I'm Aaliyah Hodges, Wish TV News 8.
Outbreak, Hendricks Regional Health has set up a 24/7 hotline. The hotline offers free coronavirus phone screenings, education, and guidance. That hotline is on your screen right now, the number 317-520-5500. You can also find it online at wishtv.com. School officials across central Indiana outside of Avon tell News 8 and parents they're ready if the virus becomes an issue in their district.
That's right. News 8's David Williams got an inside look at some of the school's coronavirus prevention plans. He joins us now to explain. David, what do you have?
So actually, this is something that you'll see if you go to a lot of these schools, in the hallways and the classrooms as well. We're talking about hand sanitizer and disinfectant wipes. This is just part of their prevention plan, which the district tells me is evolving all the time. Lawrence schools are in close communication with Marion County's health department. The district says they'll follow the health department's guidance.
Things have been kicked into high gear, and we've been making additional hand sanitizer available across the district, limiting some contact that might otherwise take place, but our buildings are cleaned on a nightly basis.
Lawrence Schools also keeps a current web page with coronavirus information and prevention on their site. The district spokesperson tells me they sent out more information today to faculty and staff about protocols that will be in place if there is a confirmed case of the coronavirus in the district schools. Right now, there are 0 confirmed cases at Lawrence Township schools. So, all new at 11, I'll tell you about some of the other school districts and their coronavirus prevention plans. For now, I'm David Williams, Wish TV, News 8.
David, thank you. Here to talk more about how the coronavirus affects children is our senior medical reporter, Dr. Mary Gillis. Mary, thanks for coming in today and helping us navigate through this. Are children more susceptible to this virus?
So that's a great question. The evidence to date says that no, children are not at a higher risk of getting this virus. And the Journal of the American Medical Association just came out with a report. It assessed 72,000 cases in China of people with the virus. Less than 2% of those individuals were 18 years or less, and no one in that age bracket has died. But there are a few things that could be going on that we just don't know about. So the first thing is, there might be children walking around just as adults are who have this virus that just don't know about it. Second thing is, children present milder symptoms, as we've been hearing, they might be less likely to seek treatment. And we understand that this is a lot like SARS and MERS in that it's a respiratory illness. And during those periods, what we learned from them, those two outbreaks, it didn't affect children as it affected adults. And we know that these two, the SARS and MERS, are types of coronaviruses.
When we hear mild symptoms, I'm a mom. So kids have so much energy that sometimes they mask mild symptoms. What should we be keeping an eye out for parents when it comes to our kids?
Right. So 3 things. Low-grade fever. We want to look for cough. And we want to look for shortness of breath, doing activities that normally would not make us sort of exhausted in that way.
Okay, Dr. Mary Gillis, senior medical reporter, thank you so much.